I'm a Muslim girl, I'm wearing a tudung. Why? I'm talking about sex and why I'm teaching them about it.
When I was 14, I realized that girls get married young in my village.
Important.
It was important for me to discuss and plan my family.
And they'll say to you, this is a life and death crisis for me, because if I can't space the births of my children, I can't feed my children.
Women in developing countries. When experts speak about the challenges these women face, they speak of shocking statistics. Approximately 290,000 die every year from pregnancy-related complications. More than 100,000 of those pregnancies are unintended. There are 80 million unintended pregnancies each year, half of them due to an unmet need for modern contraception. But behind each statistic is a woman with her own story. Hello, I'm Bonnie Urbay. Here in the United States, contraception is still widely available, even if it is a hot political issue. So it's really hard to imagine the barriers that women in developing nations face when they try to access quality reproductive services. This week on To the Contrary, we show you how women and children's lives are being saved in those countries by access to quality health services. Advocates say if people really understood the impact lack of access to reproductive health services has on women and families, if we could all experience sadness and courage that they experience visiting with these women, change would come more quickly. It's this passion that brought princesses, first ladies, philanthropists, daughters of former presidents, actors, and thousands of others, women and men, together in Malaysia. Here, Women Deliver is about delivering solutions to maternal and child health and equality for women and girls.
I grew up in Kenya in a family of 7 children and 2 parents, living in one room with no running water, no proper electricity, and no proper sanitation either.
Family planning is an essential human right. Family planning saves lives. It empowers women and girls to make positive, productive changes and choices, to seek education, to stay in school, to participate fully in society.
To the Contrary, executive producer Carrie Stein joined these global health leaders in Kuala Lumpur. She also visited a program where teenagers learn about reproductive health and a women's reproductive health clinic.
Malaysia is a diverse, multi-ethnic, and multicultural country in Southeast Asia, where Malays, Indians, Chinese, and other ethnic groups live side by side. The national religion is Islam. However, the people enjoy religious freedom. Kuala Lumpur, Malaysia, a vibrant modern city that's known internationally for the iconic Petronas Towers. In the shadow of downtown Kuala Lumpur is Pudu, a small, poor, marginalized community where a family reproductive health services clinic struggles to meet the unmet needs of women.
4 boys, 1 girl.
This 44-year-old woman comes to the clinic for all of her health needs. It's where she gets her yearly physical, blood pressure taken, and blood work. It's also where she receives family planning services.
I was referred here from the time I had my first child, which was 23 years ago.
This young family also comes here to access birth control. Husband and wife are at the clinic with their first child. Together, they'll make joint decisions about their future family.
I only want 2 babies. I have 1 baby, only want 1 more for our future.
The clinic is a member of the International Planned Parenthood Federation, which works in 170 countries. To the contrary, visited the center with IPPF's Director General and the President of Planned Parenthood of America.
We're very honored to have you both here.
There were introductions.
This is Dr. Shaw.
And an exchange of information. They wanted to know clients' preferred method of birth control.
What type of birth control?
Here, it's oral contraceptives.
It depends. The newer methods, newer types of pills, of course, are more expensive.
Do you think there are people who have needs but cannot come because they are poorer than they could afford?
At this clinic?
Well,
those who can't afford here are given free supplies.
What we do is really making family planning services, sexual and reproductive health services available both as information, education, and to get the product out to those who are in need, especially for young people, marginalized groups who are displaced, or who can't afford to pay for the services.
Malaysia's progress on women's reproductive health makes it a fitting venue for the Women Deliver Conference. Maternal mortality is down, and there are more than 4,000 family planning facilities in operation.
The government decided that they needed to invest in girls and women because after independence, they were building a nation, and they needed everybody to help do that. Their maternal mortality rate at the time this happened was around 570 per 100,000 live births. That's basically the measure. Do you know what it is today? 29.
We believe that family planning, sexual and reproductive health is at the center of the human development. We say family planning is important to empower the individual, to care for girls, to care for women, and to save lives.
Pregnancy is the leading cause of death for women globally. Reducing maternal mortality is one of the 8 Millennium Development Goals adopted by members of the UN and organizations dedicated to fighting poverty and raising the standard of living around the world. Some countries have reached some of the goals, but not MDG 5. The commitment to reducing maternal mortality lags behind in sub-Saharan Africa and South Asia. Since 1990, maternal deaths worldwide have dropped 47%. It's a good start, but the target is 75% by 2015.
The thing I want people to understand is, for me, it's part of a much broader maternal and child health strategy.
Melinda Gates, one of the world's leading advocates for family planning, came to Women Deliver to learn, teach, and inspire. Gates meets with women in some of the poorest countries.
I would be in the villages often wanting to talk to them about vaccines for their children, and they would eventually take the conversation around to, well, what about that, what they would call shot or vaccine for them, it's a shot, that I used to get for family planning.
The women and their families have had a profound impact on Gates.
In country after country, when I sit down and talk with women, they will tell you, first of all, that they'll go to great lengths to get a contraceptive tool to use. They know about them. I'm amazed how many women are educated about contraceptives and how vociferous they are about the fact that they had gotten perhaps a shot before, Depo-Provera, but then they'll go to the health clinic and it's not available. And they'll say to you, this is a life and death crisis for me, because if I can't space the births of my children, I can't feed my children.
Women often need to seek birth control without their husband's knowledge.
They'll bring into the conversation, I left the field for a day, my husband didn't know where I was going, I walked 15 kilometers to the healthcare clinic, it's not there, when am I going to be able to ever go again?
I think there's nothing more inspiring than to see a woman and girl raise her voice, and to raise it again and again and again until people finally listen and respond. To me, that's the fight of women's empowerment.
This woman, Marianne, she summed it up and she said to me, you know, what I want for this child, she was holding her baby, she said, I want every good thing for this child before I have another one. And I thought, that's it. She's captured for women what is universal in this. Every good thing for that child. That's what a mother wants for her child, no matter where she lives in the world.
So Gates put out a clarion call. She's looking ahead, post-2015, with a goal to deliver modern contraceptives to another 120 million women by the year 2020.
Our ability to create these complex partnerships and to change systems in dozens of countries will determine whether or not we get the results that we want in the future.
More than 200 million people have no access to family planning. Research shows when contraception increases, maternal deaths decrease.
In some countries, we don't even have a budget line for reproductive family planning.
In every country, it is really the combination of government and civil society and the medical profession that is making advances for women's health. And I think that's true in the United States as well. It takes that partnership.
The Women Deliver Conference brings partners together. It's the brainchild of longtime rights advocate Jill Sheffield. After getting married, Sheffield moved to Kenya and started volunteering at a family planning clinic.
On my 27th birthday, which was a little while ago, we had a clinic. And a woman came and I took her history, and it turned out that she was 27. But there, the comparison absolutely finished. Because while she was 27, she had had 11 pregnancies and had 6 living children. She had the new baby on the front and the old baby on the back. She'd been on a bus since 4 in the morning, had been waiting in the hot equatorial sun to have family planning. And at that moment I thought, wow, this is a truly brave young woman. And if she can be brave enough to come here, I can be brave enough to do something.
The Women Deliver Conference brought together more than 4,500 people from 149 countries. They all had the same message: invest in girls and women, and everybody wins.
When girls go to school for at least 5 years, the trajectory on the change in their life is like this. When she goes for 7 or more, the trajectory changes to like that. And it's not because she's learned about kings and queens or capital cities or rivers and mountain ranges. It's the fact of being in school. Her mother-in-law looks at her differently. Her husband looks at her differently. The community regards her differently. And there are miraculous things that happen as a side effect to the educational investment.
In conversations with ministries of finance, with governments, with donors, it's also important to make the economic case. And so we showed the gains not only to the individual women themselves, but also to their families, to their communities, to the nations, and to the world at large.
Thousands of people are working on issues relating to maternal mortality and empowering women and girls. Their tools include education, medication, and other health services and strategies. One of those strategies is to invest in midwives. Experts say that could save more than 3.5 million women and newborns by 2015.
All of us working together to look for ways to improve the quality of health care to the most vulnerable populations.
Investments are needed, and there is a lot that we know about what works. So now, for example, I think something like 99% of all maternal deaths actually happen in developing countries. So there are technical and medical solutions available to avert really what are quite preventable deaths and morbidity. And the costs of the deaths and morbidity far exceed the costs of actually investing in prevention.
Experts also say ending child marriage would save lives. Sarita, a young woman from a rural town in India, convinced her parents to let her stay in school instead of getting married at the age of 14.
I explained to my father what I learned in life skill education class, that getting married early has several risks. One of my friends who got married early, she was pregnant when she was young, and she died in childbirth and her baby. And I also talked about how it is important for a girl to be educated and be independent.
With nearly 3 billion people under the age of 25, the reality of a better tomorrow will ultimately be the job of the next generation of leaders. They include Barbara Bush and Chelsea Clinton. Like her mother,
that it is no longer acceptable to discuss women's rights as separate from human rights.
Chelsea Clinton is a human rights advocate.
Which I find unconscionable that in the 21st century, people continue to die from things that we've known how to prevent and treat since the 20th century.
Actress and singer-songwriter Mandy Moore, a global ambassador for Population Services International, also known as PSI, is dedicated to involving more young people.
The majority of the young people I talk to were really advocates and passionate about sexual and reproductive rights. But I put forth this challenge to people and to myself to sort of get out of your comfort zone, go up to people, start conversations, introduce yourself, make allies, make friends, support each other, push each other, challenge each other, because that's what's going to drive the conversation forward.
Barbara Bush founded Global Health Corps, offering scholarships to help nurture young leaders who believe health is a human right.
What we do every day is mobilize young leaders from around the world. We train them and then we place them within organizations working on healthcare delivery. We invest in our fellows' leadership development and we mentor them and we train them on advocacy and policy change.
Bush pointed to 2 core fellows working with the Clinton Health Access Initiative in Malawi, in a community with a 25% HIV/AIDS rate. Both of the fellows are in their 20s. Jeffrey is from Malawi and Emily from Ohio.
So they were basically working with every single HIV-positive expectant mother in the community, enrolling them in this program, ensuring that they had mentorship from other moms who had had HIV-negative babies. And in 1 year with Global Health Corps, they found all 7,000 HIV-positive expectant mothers in the community. And a year later, all 7,000 of them had an HIV-negative baby.
Access to family planning does not necessarily mean that the woman is going to be empowered enough to go and seek family planning, you know, because at the end of the day, issues to do with culture, religion, there's a relationship between culture, religion, and choice.
A former Global Health Corps fellow, Nargis Shirazi now runs her own NGO in Uganda.
I thought, all right, so there's a gap in health promotion education, specifically with male involvement, not only in family planning, but issues to do with HIV and AIDS, gender-based violence. So that's when I said, all right, I'm going to use arts and entertainment.
The twist is about reversing gender roles and engaging men in women's health and equality.
I am going to put up something so much fun, so creative, that's just going to make them go, wow. But at the end of the day, there's a message that is hidden in all that arts and entertainment, and it's working.
It's young advocates who first saw the value of technology as a tool of empowerment.
We're actually introducing a new mobile phone app for young women who've just had their first child to help them be a better mother. It's also going to start telling them things they could do to ensure that they're planning and spacing their future families at the rate they want.
Many, many young people are now coming to Planned Parenthood through their cell phones, and not only young people in the United States, but young people all across the globe. And so one of the exciting things at this conference has been the opportunity to talk to people about our ability to reach more young people where they are and where they live, and quite honestly, that's through their cell phone.
In Malaysia, 43% of the population is young people. Educating them about reproductive health and equality is done peer-to-peer. Despite great strides, recent headlines underscore the need for high-quality information about reproductive health.
We have read many cases of abandoned babies. We don't want such a thing to happen to, life, you see. So, and our concern is the young person. If she was given sufficient information, she was given enough knowledge, she would use a contraceptive if she was to have sex.
We traveled a few hours outside of Kuala Lumpur to a town called Malacca, where that support is being offered. Here at the Integrated Family Services Clinic, teens, both male and female, come to learn about reproductive health and family planning from peer educators.
I'm as a Muslim girl, I'm talking about sex and what I'm teaching them about it. But then we're looking into another perception, which is health perception. Our work is based on marginalized community. So we have seen a lot young people with HIV positive, young people with STD. So we don't want that to happen. That is my position, my principle when they ask, okay, why you are talking about this?
Dila is a peer educator at this reproductive health center.
I hope that we can educate the young generation, give them an information so that they will not turn to a wrong source of information. I want you guys to discuss how you want to prevent unwanted pregnancy. You don't have any question to ask more? The volunteer will be lie on the paper and you guys will draw her and him. This body mapping to help you guys to understand what is in your body.
I like the body mapping. We learn at the same time as we drew our friend's shape. I know all the parts of my body now.
We have the support of the government, but there are still many gaps, there are still many areas that can be improved. Okay, we have not reached zero HIV infections. We have not reached zero maternal deaths. We have not reached zero infant deaths. So there's still much more to be done.
When we give them education, they take it and then they will fight for their right.
I think the same myths that you hear at this global conference, we hear from young people in the United States who are unfortunately woefully ill-educated on basic prevention and also understanding how to get contraceptives, what basic sex education is, and also some of the fundamental questions that young people deal with, which are relationships, sexuality.
Usually we say that there are cultural, religious barriers and so on. This conference has proved that none of the above is true, because what you see here are people who are coming from different political spectrums, from religious background, racial, cultural, geographical regions. The world is united in saying that, yes, sexual and reproductive health and rights are important.
We had such a tough time getting sexual and reproductive health into the Millennium Development Goals. It continues to be a need. It's not over. That is an unfinished agenda that we need to continue to focus on. So anything we do in terms of sustainable development goals for the future, we need to keep this at the center.
There are several countries that we've seen quite considerable and dramatic changes. Burundi started with 2.9% about 3-4 years ago, prevalence of modern contraception. Today, they are almost 25%. And we are very confident that with the new visibility family planning has, we should be able to push even further and make a difference in the lives of people.
On the very first day, I had the first word. And I asked participants to decide what it was they were going to do when they leave here, because frankly, that determines the success of this conference. They have different ideas, new solutions, new information. And girls and women are the story. Family planning is the most efficient way to invest in women's lives. And the 2015 Development Agenda is a crucial pathway for all of us.
The work ahead, it will be difficult, but I'm optimistic because I know we are all united by a single, powerful premise that what matters is doing absolutely everything we can to help women and girls flourish worldwide.
We here at To the Contrary will continue to follow this issue as women and girls make progress toward a more just tomorrow. Please follow us on Twitter @To the Contrary and visit our website pbs.org/tothecontrary, where the discussion continues.
Equality to me is the key to this. Inequality harms everybody.
I think it's just the right to have a choice, the same opportunity, the same rights, the same access.
Having women's voices be equally heard and acted upon as men's around the world.
The man and the woman should be equal.
I am just the same as you. It's that power in unity, that is equality to me.
What does equality mean to me? Equality means not having to ask what equality is anymore.